Did you find school difficult? Do you see your children struggling to memorize, comprehend, and perform well on tests? Do you notice a gap between what you know and what you do? Children and adults with learning difficulties, such as ADD, ADHD, and dyslexia, typically have problems with organization, time management, and completing projects. It's been reported that since 2001, the use of drugs such as Ritalin for treating attention deficit disorders in children under age 5 has risen a dramatic 49%. 3 to 10% of all children have attention deficit problems, and 20% suffer from learning difficulties such as dyslexia and dyspraxia. Now, you can correct ADD, ADHD, and dyslexia permanently, forever. Unlike drugs, which work outside the brain, we treat learning difficulties by working inside the brain, rewiring it to behave normally.
Crossinology is an acupressure technique that I developed over 22 years to rewire brains so that they work at their maximum potential. So I changed the electrical functioning of the brain.
Susan McCrossin specializes in treating learning difficulties using the Crossinology brain integration technique, a non-invasive, therapeutic treatment focused on eradicating learning difficulties through renormalizing brain pathways. Crossinology's brain integration technique, also known as bit therapy, addresses concentration, memory, planning, comprehension, and visual and auditory processing. The basic correction program takes approximately 8 to 12 hours, spaced over a number of visits, and may vary based on individual needs. The first session of treatment includes an initial assessment that serves as a benchmark from which future changes can be evaluated. This assessment involves muscle testing to reveal the specific brain areas that need the most attention. Treatment then deals with the brain's deep-level switching, the pathways that handle right-left, front-back, and top-bottom processing. After switching pathways, treatment focuses on the degree of activation in the corpus callosum so that the brain's two hemispheres can be used simultaneously. The limbic system is treated early in the procedure, since it is the emotional filter through which the brain processes all information. From there, we treat the eye muscles, auditory processing, sense of balance, and the vestibular system. Finally, treatment turns to coordination and fine motor control. This procedure integrates and synchronizes all the signals in the brain. After completing the Crossinology bit treatment, the client enjoys living a life full of self-motivation and actualized potential. This translates into the ability to multitask in the classroom or any other situation in life.
One of the most rewarding things about doing this work is having a child come back to you and tell you, looking you straight in the eye, that they just got 10 out of 10 for a spelling test for the first time in their life. You have just changed their future.
You can end your dependency on medication forever. To find out if Crossinology is a good fit for you, fill out the questionnaire at crossinology.com.